Hello everybody, and welcome to another video. We are continuing to look at the, sorry I'll just move this slightly. We're continuing to look at the Renaissance and early modern Britain, the second of our time periods. And we're building on the thinking we did last video, in which we talked about what the Renaissance was, and we talked about how it came about and how it was different from the medieval period and what changes it kind of brought in. We finished by talking about three key people in the Renaissance. We talked about Vesalius, who did drawings. We talked about Pare, who developed ligatures, and we talked about Harvey, who sort of developed theories about the circulation of the blood. Excuse me, get this right. But we kind of finished by thinking about how the Renaissance was mainly about new ideas and new theories, and didn't really necessarily lead to treatments and changes in treatment for ordinary people. So we're going to develop that a little bit further today and look at sort of how things either changed or stayed the same during the Renaissance, and just a little bit more about the kind of treatments that were available for people, and we'll kind of begin to head off into looking at surgery and public health as well. Okay, so we had those three main people in the Renaissance, and they're sort of your primary three to think about. But we also have, we need to talk a little bit about Thomas Sydenham. Now, Thomas Sydenham was often called the father of modern medicine. This is really annoying. Let's get it right. Let's see if I can get it to stay this time. Thomas Sydenham is the father of modern medicine. He's called that. Sometimes he's called the English Hippocrates as well. And you'll remember Hippocrates being the father of medicine in ancient Greece. And Thomas Sydenham was a Renaissance physician. So he was born in 1624, and he worked as a physician in the parliamentary army during the Civil War. And so he, one of his jobs was obviously treating soldiers and treating people who were obviously ill. And Thomas Sydenham, I think you can sort of think of two main things with Thomas Sydenham. If you think about the four humours and we think about that theory and miasma, none of those theories, I suppose the four humours a little bit, but none of them are really linking a specific illness with specific symptoms. But that's the thing that Thomas Sydenham concentrated on, is the idea that particular symptoms actually tell you what disease the person is suffering from, which to us sounds like, sort of the equivalent of saying the sky's blue. Well, Thomas Sydenham, certain symptoms mean certain diseases, but that connection hadn't necessarily kind of been made. If you think about the four humours, the symptoms are there, and the symptoms tell you the treatment, but they don't really tell you why the person kind of was suffering from that imbalance in humours. They don't sort of really make a link between the symptoms and the disease. We know that the doctors in the Arab world had made that connection, but Thomas Sydenham is the first person in the Renaissance to widely make that link between symptoms and a disease. And of course, that's central to the Renaissance, which is based on as we talked about last lesson, scientific method, or last video, sorry, which is based on the scientific method, which is a method of experiment, observation, coming up with theory, designing experiments again, observing the outcomes of those experiments. Well, Thomas Sydenham is talking about observing symptoms in the patient, not going to a book or the works of Galen or Hippocrates, but instead getting your eye on the actual patient, looking at the symptoms they're showing, and every pattern of symptoms links to a particular disease. Okay, so he was a real clear kind of advocate for that approach, that actually you look at the symptoms and that tells you the disease, which again seems sort of basic to us, but if you think about what had gone before in terms of miasma theory, you're not getting that sense that there's a lot of different diseases out there that are affecting people. You think about theory of the four humours, that theory is supposed to cover all illnesses, all diseases. What's the answer? My humours are out of balance. That applies to everything. It's not about different diseases being out there and somehow coming to us. Miasma theory, what's the cause? Bad air. that bad air. There's only one type of bad air, and it makes you ill. What we're talking about here is a range of symptoms that, in a particular configuration, a particular pattern, direct the physician to think about a particular disease. So a range of symptoms, that particular range of symptoms links to that particular illness. A different range of symptoms can lead to a different illness. What's causing those illnesses? In the Renaissance, we're not there yet, are we? We don't understand germ theory. We might still go back to kind of miasma or bad smells, but each individual range of symptoms links to a particular disease or illness, and that's what comes from Thomas Sydenham. The other thing that kind of follows from that is that Sydenham was an advocate of, or he was in favour of doctors doing as little as possible. Okay, now doctors doing as little as possible is a really good idea, because the human species, just like other animals, has evolved to be able, within certain limits, to be able to repair its body. And doctors actually getting involved in treating illnesses can actually get in the way of the body repairing itself. That's obvious. Okay, so the idea that you might go to a doctor and they'll say, yeah, I see you're ill, I see you've got this problem, what you need is a lot of rest, you need to stay at home, I'll sign you off for a couple of weeks, you don't have to go to work, and you walk out of the doctors and you're quite happy with that as a kind of treatment program. Doing nothing, resting, giving your body time to recover. That's our current situation. You go to the doctor says that everything's fine. Okay, your doctor's not done anything, has he? And that is a really important part of medicine and medical treatment now. The idea that we give people time to recover. We don't do anything. We just give them time and space to recover. Perhaps they take some time off work, go to bed, lie down, rest, relax, until they're better, and let the body heal itself. But you imagine in a world where you had to actually pay for the doctor, you had to pay to go and visit a doctor, it would be quite a brave doctor or physician who was willing to, take your money from you and then not provide some kind of intervention, not do anything. You go to the doctor, medieval or Renaissance physician, and you say, I've got such and such a symptom, and he says, yeah, I can see that. Yeah, what I want to do is absolutely nothing. Now, can you pay me, please? You'd be, well. So there's always a tendency for doctors to intervene too much, to do too much, to justify the money that they're charging, to justify the expense of visiting a physician. A good doctor is one who provides a good service, and in the Renaissance and the medieval period, a good service would be getting involved and doing things to justify the money that you've charged. If doctors are charging for their services, then they have to actually do something. And unfortunately, doing interventions on the body can often get in the way of recovery. So there was always a tendency for that to be the case. And it's quite a long and difficult process for doctors to now move to a situation where they don't actually get involved all the time. They let the body recover itself, and that process involves in some way getting money out of the equation, because if you're paying for a doctor, there'll be that tendency for them to have to do something. It's only when as we now have a national health service where it's free at the point of access. When you go to the doctor, you don't pay, so you don't actually there isn't that sort of pressure on the doctor to do something, and therefore we now accept that sometimes you go to the doctor and they don't give you tablets, they don't give you antibiotics, they do say, well, this is the best remedy is to go and rest and do nothing. Sydenham was one of the first doctors to advocate observation and doing as little as possible, and that's a big step for medicine. Okay, and that comes about in the Renaissance because of this renewed interest in observing the natural world and observing the real world, rather than using the Bible, using religion as a sort of doorway into what's really happening. Instead, observing and using the scientific method, and Sydenham is part of that observation of symptoms, which then leads to the idea that you actually sit back, you don't do so much, you allow the body to take its own course. Okay, so Sydenham's an important one. Okay, another person who, can't quite see him on here, another person who is really important at this time is John Hunter. And he's going through a similar approach, or a similar, similar approach in terms of surgery. Okay, he was seen as one of the best surgeons of his time. He was a famous teacher of anatomy, and again, he, believed that the best approach was to leave things, leave the body to heal itself. You might stabilize the person through the use of ligatures. You might stabilize them through cauterization, but actually, a lot of the sort of healing of the body happens on its own without medical intervention. And John Hunter, as an example of a surgeon from the Renaissance period. Okay, and that kind of leads us nicely into surgery. So surgery is obviously one of those strands of medicine that we've come across before. We talked about barber surgeons in the Renaissance, and in the medieval period. And if we kind of look up here, we can see, which we've talked about in the lesson, a woodcut of an amputation that's been carried out in the Renaissance period. And we can see that actually, there's a lot here that's very similar to the experience of somebody going to a barber surgeon. We've got a patient who's awake. We've got a sort of fairly brutal scene. We've got a scene where he's obviously in pain. We've got an aggressive scene. We've got a scene that's in, there's a bed in the background. It could be the person's bedroom itself. There's very little specialist equipment here. We've got a bone saw, or tendon saw, I suppose, like a hacksaw really, that's going to cut through his leg. We've got a table, which, wow, technical equipment. There's a table with a bit sticking out so you can tie the leg to it more easily, which allows the surgeon to kind of cut just off the edge of the table. Hardly technical equipment. We've got a cushion. We've got various assistants who are holding the person down. We've even got down here a little brazier, which has got fire in it, presumably with cauterization equipment in it. Okay, so we can see there a typical kind of surgery scene from the Renaissance period. And there's a few, obviously there's plenty there that's very similar to barber surgeons. There's a few hints at kind of some developments and some changes though. And first thing to really talk about, I suppose, is this brazier. And you may remember when we talked about pare, about the difficulty of using ligatures at a time when you don't have anaesthetic, because ligatures are the bits of string, catgut or whatever, that would tie up the veins and the arteries in the leg or in the arm that's been amputated in order to stop the patient bleeding to death. They're an alternative to cauterization, and yet here we are in the Renaissance with some cauterization equipment here. But it reminds us of the difficulty of using ligatures when somebody is squirming in pain. This is a very quick operation, whereas ligatures take time. And it reminds us of the difficulty of solving one of the three problems of surgery when you're not dealing with the others. So the three problems of surgery being blood loss, infection, and pain. And you can't really solve one without the other. You've got a solution for blood loss, which is ligatures, but because of the pain and the risk of infection, although they didn't know why things got infected, but certainly the pain means that the operation has to be over quick. It has to be done, rapidly. You've got to hold the guy down. You can't hold him down for hours and hours and hours. We've got these people holding him down, so the whole thing can be over quite quickly, which means we haven't got time to do ligatures. So we're still using cauterization. Okay, but we do see here that we've got a kind of gradation of people between the person who's in charge, and we've got some people who begin to look like they are assistants of some kind, and that does lead us into a couple of changes that we see during the Renaissance, and we begin to see the idea that surgery is not just a sub branch of barberism, being a barber. It's the lockdown, so I haven't had my hair cut for a while. For example, I could go and visit a barber, and as an aside, I might get some surgery done. But we get the beginnings of actually the development of sort of more of a professional approach to surgery, it being something that is separate from hairdressing, And it involves a separate range of skills, and those skills need to be taught and they need to be assessed, and there needs to be some validation of the surgeon as being, a kind of a person who has learnt those skills, some way of validating, of making sure that they have passed the appropriate sort of requirements. Okay. And we could look at this as an example of a surgeon and perhaps his apprentices, because we begin to get a more formal program of apprenticeship during the Renaissance. We've got surgeon. We wouldn't necessarily call him a barber surgeon anymore. He's now perhaps a professional surgeon, and he has an apprentice. Now, an apprentice is a person who is usually a young boy who is learning the trade from the surgeon himself. And this was the mechanism by which people would quite often be educated during the Renaissance. You might have very early schooling, but then from about the age of maybe 12, 13, 14, a young boy who wanted to go into one of these professions would be apprenticed to the professional, in this case the surgeon. An apprentice would work for free, they wouldn't get paid, but they would basically be owned by the surgeon, and there'd be a contract drawn up between perhaps the parent of the boy and the surgeon that would set out how the surgeon would teach the boy the skills of the trade, and how long the boy would therefore be under the control of the surgeon. So most apprenticeships tended to last maybe 7 years. Some were longer, some were slightly shorter, but generally if you sort of think about 7 years apprenticeship, whereby for that time the boy is working for the surgeon in exchange for food and board. He would often live at the surgeon's house, or live at, it wasn't just surgery, it was all kinds of professions really, and in return for the services that he provided as an assistant to the surgeon would train him and teach him, and he would look after him. It's almost a form of adoption, if you like, and he would be trained up to have the skills of, in this case, a surgeon. So you've got kind of a clear progression from sort of the barber surgeon, it's just something I do in my spare time because I'm the guy who's got the the tools because I'm cutting hair, to something that's much more of a sort of standardized profession. And that process of apprenticeship is beginning the process of turning surgery from something quite brutal into something that's a little bit more thoughtful and a little bit more professionalized. And along with that goes the development of more formal recognition of where people have gained sort of qualifications or served apprenticeships as in surgery. And we get the start of the government becoming involved in licensing medical practice. Now, we've talked about government in terms of the medieval period before, and we talked about how the government mostly are fighting wars and defending the land from people. But here we've got the development of government intervention in medicine, not obviously directly, but just instead in terms of the king, it would have been a king at the time, setting up societies or being a patron of certain societies that were run by the surgeons or run by the physicians, and they would be like called a college, but really it's just sort of a bit like a union, I suppose, that someone now might join, like the Union of Teachers or whatever. But this Royal College of Surgeons, which we're talking about here, which was set up during the Renaissance, the Royal College of Surgeons, it provides a license. It's like a mechanism through which surgeons can, validate each other and say, yeah, you've met the minimum standard, you've served an apprenticeship, you've got the skills needed, and therefore you get a license. And then local governments or the sort of town councils of England can say, well, you can only be a surgeon in this town or this city if you have a license from the Royal College of Surgeons. So we got the beginnings of government, if you like, the royal side of it, the king being involved in promoting some kind of professionalization of learning. In this case, we've got surgeons. There was also a Royal College of Physicians from about 1600 as well. And there would be an examination by that college, perhaps, of the people who were applying for a license. They'd maybe have to come in and talk about what they'd done, what experience they had. You might have to kind of have served in an apprenticeship. But this is very, very slow, very slow. And it still is not seen as kind of, we think of now of surgeons as people who've been to university. Well, we talked about university doctors in previous video or videos, and we're still not at the point where we've got that practical education coming through the universities. Instead, it's the apprenticeships of surgeons, serving an apprenticeship with a surgeon, that then allows you to apply for a license. But again, the beginnings of government involvement in not the provision of healthcare, but regulation of healthcare, of making sure that what's being provided is of a certain standard. Okay, that leads us nicely into this little picture, which we've seen these things before. And again, we look at the Renaissance, and actually, this, remember, we're kind of comparing London through time, and the previous one was the Middle Ages, and we saw there was huge amounts of problems with the regulation of health and welfare in the town. And really, things haven't changed greatly by the time of the Renaissance. We've still got a lot of medieval buildings around that are very much kind of dilapidated. And in fact, during the Renaissance, London becomes the biggest city in Europe, and we've got increased problems of disease really in London during the Renaissance, because it's kind of grown so much, and the overcrowding that's occurred has kind of forced more and more people together into a smaller space, and they still don't have the infrastructure needed or necessary to remove waste from the city efficiently. So actually, there isn't a great deal of change in terms of the provision of public health and government intervention to kind of promote healthy cities and healthy towns. And again, we see here, a lot of hangovers from the Middle Ages into the Renaissance. We've talked about how the Renaissance is, more about theory than actually changes in practice. And we've still got people talking about the four humours. We've still got, people coming up with new treatments that aren't really tested via the scientific method. So although we've got the theories and the hypotheses and the kind of great ideas of Vesalius, Harvey, Parry, Sydenham, John Hunter, they aren't necessarily getting down to the everyday level of ordinary people, whose healthcare is still mostly provided by the lady of the house, mostly provided by the mum. Okay, and at that point, we'll draw an end to this video, slightly short one, but I will put up another one shortly, which will look at medicines and treatments, and then hospitals during the Renaissance. Okay, thank you. Bye.